can I have breast implants if I have COPD? So COPD is chronic obstructive pulmonary disease. I mean, usually, I don't know if I'm being, I don't know if the COPD community will backlash on me, but usually COPD is kind of like an older demographic. And so breast implants in patients with COPD is not a common occurrence, but just because it's not common doesn't mean it shouldn't be done. So that's the first thing. What I would say is it kind of depends on how bad your COPD is. COPD can often be quite bad. You can be quite breathless. Sometimes you need oxygen. And so it might be the case that if your COPD is bad, then you it might be a no, basically. But it's definitely a might. I mean, you might there are a range of severities for COPD. So if it's quite mild and you've got quite good exercise tolerance, if you can kind of walk up a flight of stairs and have a relatively normal life, you go to the shops, etc., then perhaps you could have it done. So it's not a definite no, but it kind of makes me think it might be a no, to be quite honest with you. But we would definitely, and we could just talk to you. We wouldn't have to have a consultation. We just talk to you. And the other thing I often say to people with medical problems in general is to talk to their doctor who looks after the medical problems. So if you've got a doctor who looks after your COPD, maybe say, thinking of having breast implant surgery, what do you think? Because usually if it comes to it, I would take advice from them. I would take advice from your physician who's looking after your COPD, and as well as the anaesthetist. I mean, really, it's the anaesthetist who would be kind of like the final judge on that. But I would say it's not a common occurrence, people with COPD having breast implants. But it never say never. But I would be a little bit maybe a little bit negative about it, thinking that maybe we wouldn't be doing it. But we might, probably not. But you can always give us a call and we can talk to you and stuff. I guess we can maybe get an assessment of how bad you are and talk to the anaesthetist if you want, even before coming to a consultation, so you don't have to pay for a consultation and stuff if you want to have an idea, because you don't want you bringing to your consultation and paying for a consultation and then us telling you we can't do it. To be honest with you, if we did that, if you came for a consultation, paid for a consultation, and we said we couldn't do it, we would refund you the consultation, because if we say we won't do it, then we will refund the consultation.